Good afternoon, everyone. I'd like to welcome you today to mHealth+SocialGood. We're really excited to be hosting the first ever mHealth+SocialGood. For those of you who aren't familiar with the +SocialGood platform, it was really an outgrowth, an extension of the Social Good Summit, which takes place every year right around the same time as the UN General Assembly. And as I've heard it described, we really wanted Social Good Summit to be more than a moment. We wanted it to be a movement. And so that's why we created this really exciting and innovative online platform to help people connect. +SocialGood is a global community. It includes innovators, social entrepreneurs, and thought leaders, all united around a shared vision that today's connected generation can leverage technology and new media to help create a better world. And it's really wonderful to have a group of innovators and technologists here gathered at the mHealth Summit. We're so happy to have you with us and happy to have everyone with us via live stream as well. So I hope you enjoy today's program, and we have a very special guest to get us started. Some of you may have heard him keynote at the mHealth Summit this morning. It's Professor Mohammed Yunus, who is really a man who needs no introduction. He is a Nobel Prize laureate. He is the founder of the Grameen movement, and to many in this room and around the world, he's a true development hero. So we'd like to welcome Mohammed Yunus to say a few words to us before we get started.
Thank you very much. Thank you. Well, hello everybody here, and hello everybody who are not here somewhere else in the cyberspace, and greetings from all of us here. We had a wonderful day beginning with the snow and everything, but with very warm discussions. And today we talked about, I talked about my experience in bringing mobile technology to healthcare, and talked about particularly the identifying the risky pregnancies, because this is one of our high priority item in Bangladesh, because we are kind of still not at par with the Millennium Development Goal, and we want to make sure by 2015 we want to achieve all 8 Millennium Development Goals, and we already have done very well to make it happen. We even outdid the target date, because we achieved the #1 goal of reducing poverty by half by 2015. Instead of 15, we did it by the middle of 2013, so 2.5 years before the launch date, the ending date. So that was a great achievement for Bangladesh that encourages everybody to move ahead with achieving all other 7 Millennium Development Goals. So here technology can play a very important role. That's what we have been discussing. And we talked about how mobile phone technology is taking shape, getting rooted, and all these experiences around this hall, around the halls that we spoke, and the displays are here. It's a wonderful evidence that how much seriousness we put behind this technology. So we are raising all these issues, how this technology should be oriented. There are many things in the technology. Technology I always refer to as a kind of a vehicle, like a car. You can take it any direction you want. It doesn't have its own mind. Mind is ours. So we decide where we want to take the technology. If we want to take this technology to the height of the profit making, we can do that. We can make lots of money by using this technology. But if you want to use this technology to solve people's problem without having any intention of making money out of it, then we can do wonderful things. So it's our choice. That's the point that I keep raising. And all the mobile technology we are talking about, we have to be very clear. What do we do with this mobile technology? We want to make money serving people and make profit out of it? Or use these technologies to solve all these global problems that we see around us? And we use this in focusing and solving all these problems. I bet you all this problem will be solved very soon, because the technology has that power. We have already demonstrated in our discussions, in our displays, how it's taking shape. And it's what we see now is only just a little scratch, just a little beginning. It's like a seed bed. We have not seen really sprouting yet. The technology has the power to become a giant tree, covering everything. So this is at that stage. We can make this seedbed really grow to help people solve the problem. and social goods people all around who are on the live streaming joining us. This is a wonderful occasion to talk about the social goods, and I'm explaining what I do with social business. I mentioned all the social business healthcare initiative that we have taken, sometimes with the joint venture with large companies, sometimes just individual little program, but it's a social business. Social business doesn't have to be a big, giant business. It could be just a tiny little thing as a business format, self-sustaining, no intention of personally benefiting from it, but solving people's problem. Then you have developed a seed. That seed now became planted and replanted and multiplied and make a big, big plantation to solving big, giant problems. So that's what the social business is all about. And I mentioned in the morning how we have done applying mobile phone technology in sort of cases, and say potential of mobile technology is to become a sort of Aladdin's lamp. You can touch the lamp and digital genie can come and solve the problems. And that's the starting point for all of this. We have developed a box, a little box, what we call doctor in a box. We have all the diagnostic tools electronically done, so that you take all the information of a person and immediately transfer to the mobile phone wherever you want. So you don't have to bring the doctor, all the tools of the doctor in that electronic box, where you can take all the information of your body and transfer it to the doctor, wherever your doctor is, or preserve it. So this is one of the things we are using mobile phone. Also designing a smart card where all your information personally you can keep, as much information, as entire family information kept, all the tests you have done, all the results you have ever made, all the symptoms you have gone through in a smart card. So that whenever you go, all this information is available. You don't have to rediscover all these things. So this is what the social goods people will be looking forward to. And I mentioned about projects that we do for malnutrition, which is not connected with mobile phone yet, but there's a possibility how to connect it for monitoring purposes. As mobile phone is also good for screening, good for monitoring, good for following it up, good for reminding. Many different ways we can use that. So each piece of it can be a social business. So all of you who are listening around the world with the internet, I will urge you to create your social business ideas, whichever idea that you can come up with. And if you can share with each other and share with us, and we'll see how to connect each other to make it happen. Our job is to take these ideas and make it happen on the ground, test it out. And this is how it goes. We have done a joint venture with Danone. We've done joint venture with FIFCO in Costa Rica to produce soup fortified with all the micronutrients. We have done in Colombia with Panuela, which is a kind of a molasses. They are very popular drink for poor people all over Colombia. They drink it all the time. So we said, since they drink it anyway, why don't we fortify it? It just costs tiny little money, just this almost insignificant amount of money to fortify that, so that everybody can enjoy that at the same time, get the health benefit out of it. So there are so many other intentions, other good ways to do that. There will be a panel discussion now. So I will conclude here. Greetings from Washington. We are having fun here, and we want you to join here with all our fun that we have with the snow and everything else. Thank you very much. Thank you.
Thank you so much, Professor Yunus. That was a wonderful start to the program. Before we get going with the heart of the program, I would just like to say a special thank you to the sponsors of this event. First of all, for the generous support from our friends at Johnson & Johnson, and also our friends at HIMSS, who have been wonderful. And the mHealth Alliance also would like to thank our partners, MAMA, the Mobile Alliance for Maternal Action. So it's a wonderful group that has brought this program together today. We are going to have two really interesting and exciting fireside chats for you today. And the first is going to focus on mHealth to 2015, mobile technology to drive towards the Millennium Development Goals. We have a wonderful person to moderate this panel for us, so I'd like to bring up Alice Lynn Fabiano from Johnson & Johnson, as well as all of the panelists for the first fireside chat.
Hello, everyone, at the mHealth Summit. What a great, great day to be with everyone, and thank you so much for joining. I know that I'm really excited to be here with the rock star panel, and even though it's always hard to, how can you follow someone like Dr. Yunus, but our panelists are going to try, and they are all heroes in their own right in pioneering a lot of the work that's been done within bringing mHealth to the Millennium Development Goals. Thank you, Chelsea, and to the mHealth Alliance, who have been incredible thought partners in planning these two panels, and to HIMSS as well for supporting this event. As Chelsea had mentioned, my name is Alice Lynn Fabiano. I am from Johnson & Johnson Corporate Contributions, and today we're going to speak about a topic that's really near and dear to my heart, near and dear to many of our hearts, and near and dear to the hearts of the folks in the panel, and that is on reaching the Millennium Development Goals, particularly the Health Development Goals. So what I'm going to ask for all the panelists to do, and I'll ask you also to introduce yourselves and your organization as well, is to speak a little bit about some of the projects that you've been involved in, specifically one related to MDG 4, 5, and 6, and how you have seen the mobile phone really accelerate progress towards reaching those goals by 2015. So I'm going to start off with Sean Blaschke, who's right here on my left. Sean, I'm going to ask you to quickly introduce yourself. And again, the question is, talk about a project that you've worked on specifically and how that has helped achieve or accelerate progress towards MDG 4, 5, and 6.
So my name is Sean Blaschke. I work with UNICEF as a health system specialist and provide direct support to our Uganda office and a host of offices in East and Southern Africa as well. So one of the programs that I think UNICEF is most excited about right now is an initiative called U-Report. For UNICEF, U-Report is providing a new way for us to engage with community members, with youth. Essentially, it's an SMS, WhatsApp, Facebook platform for social dialogue. And what we're doing right now in Uganda with this is creating vibrant discussions around whether Ugandans are accessing health services. Are they happy with it? Are these services being provided in ways that are intended to? We've managed to get every single member of parliament as part of U-Report and have engaged many different government ministries, from the Office of the Prime Minister to the Ministry of Health. And so this doesn't fit into the same kind of mold that I think a lot of other projects here are focused on, providing diagnostic tools for frontline health workers, strengthening health management information systems. But for UNICEF, the ability to truly tap into and engage the citizens, the health consumers. Again, in Uganda, we actually have over 250,000 registered users of U-Report right now. So on a day-to-day basis, we are hearing directly from people about what they're seeing, whether the services, again, that they're receiving are they happy with, and again, working with government, providing this back to them, strengthening that social contract between citizens and service providers. And for us, this is a very new way of doing business. Participatory development is no longer a buzzword. It's actually happening, where again hundreds of thousands of people are participating. Hopefully you'll ask a few questions about these new models, because they're fascinating for me. And thank you very much.
Good morning. My name is Matt Berg, and I'm the founder of a new social enterprise called ONA. It's a software company basically based in Nairobi, Kenya, and New York. And I was formerly at the Earth Institute for the last 7 years. I first just want to plug a little bit more kind of the work that UNICEF Uganda is doing. There's another project called MTrack, which is basically SMS-based reporting, aggregate reporting that feeds into HMIS systems. And also DHIS2, which is an initiative of the University of Oslo. And I think those are both really good examples of facility-based aggregate reporting that is really starting to scale, and I think is going to be really commonplace in the next couple of years. So I think that's having a huge impact in terms of letting governments see what's going on the ground. And I'm sure Richard could talk more to that. One of the projects that I'm working on right now with Garrett, who's from WHO back there, and Columbia University and NGO called FRHS in India is a smart registry project where we're developing a tablet app for nurse midwives. And what I think is really exciting by that is I think it kind of represents a little bit more of where mHealth is going, where we're not just focused on data collection, but also how do we use a screen, like whether it's a smartphone or tablet device, to provide information back to the healthcare worker that hopefully actually adds value. So kind of that local feedback loop with their own work, but also could be used for providing video feedback or providing video trainings to their clients. So I think that's one of the projects we're working on, which I could talk more about later.
Thank you. My name is Dr. Richard Gakuba from Rwanda. I'm an e-health consultant, e-health and mHealth. I've been formerly working for the Ministry of Health as the National E-Health Coordinator for over 8 years until June this year. One of the projects that I think are quite relevant to this discussion, the mHealth project that I worked on since its inception until today, is a project where we use SMSs to help or to register all pregnancies in the country and also track the pregnancies, pregnancy outcomes, and early childhood for 2 years of early childhood. So it's an SMS-based system. The community health workers, when they realize they have a pregnant woman in their community, they register the pregnancy with all the relevant clinical information. And that system also triggers messages back to the community health workers and advises them on either reminding mothers to go for ANC or reminding mothers to prepare for delivery 2 weeks prior to the expected date of delivery. But most importantly, they also register any high-risk events that could take place during pregnancy. Say, for example, if there's any bleeding, the community health worker will send a message, and the system will send alerts to the relevant healthcare facilities nearby. So typically, they could just pick a phone and call the community health worker and tell them what to do, but also they could dispatch an ambulance if it's an area where an ambulance can reach. So we have covered the entire country now. We are receiving about over 10,000 messages every day. We're using 45,000 community health workers, reaching almost everybody in the country. So it's a very, very exciting project. And I hope that, we're going to cover everybody else who may not be covered now. So, thank you.
Thanks. Hi, everyone. My name's Joanne Peter. I'm the Deputy Director of the Mobile Alliance for Maternal Action, MAMA. And, of course, working at MAMA and soon to be a MAMA myself, I'm very passionate about Millennium Development Goals 4 and 5, and also being South African Millennium Development Goal 6. So I hope you'll allow me a brief moment of personal reflection, because I was thinking this morning about the fact that it's almost exactly 10 years to the day that I graduated as a young and idealistic doctor in South Africa, about to start my first job as an intern at a secondary level hospital in Cape Town. And anyone who works in HIV and has worked in South Africa would know that 2003 was just a really, really difficult time to be a doctor in that country, because we had this enormous burden of HIV and we had just no access to antiretrovirals and no prevention of mother-to-child transmission of HIV. So we were overwhelmed with disease and we had no drugs that worked. And that was devastating, because you would have a mother that would come in saying her child was sick, and then you would discover that the child was HIV positive, mom was HIV positive, and dad was HIV positive, and there was nothing you could do about it. And what was incredible was that by the next year, 2004, we actually had a change in government policy and we could start to roll out antiretrovirals. And it was remarkable to see the difference. I mean, I heard someone tell a joke saying that the two major side effects of ARVs in kids is that they get fat and they get naughty, which is just phenomenal to hear. And so now in 10 years to see this transformation where you can work on a program like Mama, where we use mobile phones to actually support mums through every step of that journey, when she first discovers that she's pregnant, that she's HIV positive, comes to terms with her diagnosis, starts on her antiretrovirals at 14 weeks gestation, stays on those antiretrovirals through labor and delivery while she's breastfeeding her child until the child is a year old. That's just been a phenomenal transformation and an incredible use of mobile phones to actually be able to support women now so that we can start to eliminate the transmission of HIV from mother to child. And so that's what we do at Mama, and it's really a fantastic program to be part of. Thanks.
Thank you, everyone. And before I forget, for those who have questions for the audience, I will start some of them, and we really want to hear from you. Please ask questions. If you are on Twitter, please use hashtag #SocialGood and hashtag mHealth13, and we'll get those questions up here and have our panelists answer them as well. Joanne, I just want to stick with you as your story is so personal and really a testament of what over the past decade could really happen within a country with the development and the explosion of mobile phones. And, Mama is a 3-year partnership that had started in 2011. It's coming up on its 3rd year. And so my question for you is, what's next? And what's next for you? And what's next for Mama?
It's a great question, and actually it's a nice one to be asked, because when Mama was first announced in 2011 by former Secretary of State Hillary Clinton, we actually didn't know whether it would have a life past 3 years. We thought that perhaps it would be coming to its end early next year. And now we're really delighted to say that's not going to be the case, because we have been so overwhelmed by the demand for programs like this. So in the almost 3 years that Mama's been around, we now have 2 national programs in Bangladesh and South Africa. We have almost 300 organizations that have downloaded the Mama content because they want to start programs like this for themselves in countries around the world. And we've been listening to the requests that are coming in from these organizations for all sorts of additional tools and resources. It's not just content. It's about help with technology platforms. It's about monitoring and evaluation. It's about working with governments. And so there's an incredible demand, and we're very responsive to that demand that's coming in from the field. And so I think the hope for Mama is that we would continue to be able to serve those needs, hopefully through a new affiliate program that we want to get started, where we would provide more one-to-one support with organizations that really want to go to national scale, and then through our global learning program, which provides a lot of online training, tools and resources for the wide range of organizations that want to start sometimes smaller programs around the world.
Thanks so much. And Mama, to a certain extent, works across a whole bunch of different partners. I think, Sean, for UNICEF as well, given the broad reach in countries within that UNICEF serves, there really is a breadth of the work that can be done even within your organization. And we were just having a conversation about technology and innovation, and whether or not those are 2 kind of buzzwords that are really infiltrating a mainstream into a legacy organization like UNICEF. And in an earlier panel, I will quote you, who you quoted someone else, but I thought it was such a fascinating quote, that mHealth does not become interesting until the technology is boring. Where do you think we are in that phase, and where do you think UNICEF is in terms of, is technology boring yet, or are we still really excited by the bright and shiny coin of technology and innovation for achieving MDG 4 and 5 and 6?
I think we're still very early in that process, and there is a lot of excitement, which is great because it brings out big crowds like this today, but it also still creates the impression that we're doing something different, that we're doing something that's parallel to what the health sector is doing. And that's something that we've been trying to, as UNICEF, break down and get people starting to think about using technology, using social media as just an integrated part of our health programming. Looking at this, we've organizationally started to shift away from having innovation and technology being the outcome and move towards using that to being something that gets us there, some tool that supports our existing programs. But I still think there's quite a ways to go. We're at an mHealth summit. Hopefully in a few years, we're not at an mHealth summit, we're at a health summit, and this is the way that healthcare is being provided. So we're working towards that, I think, as a lot of these tools become routine, as the community healthcare workers in Rwanda stop getting excited about the mobile phones and become much more excited about what the phones are doing, connecting pregnant mothers with hospitals, with health facilities, and with ambulances. That's where I'm hoping the excitement moves towards, and a few years, and I think we'll be there.
And we'll hear more about where mHealth will go and beyond in the next panel. So thank you for that. I'm going to turn to Richard. Richard, last night was the celebration of the 50th-year anniversary of the mHealth Alliance. And at that dinner, you were also awarded the first Pioneer Award, the Holly Ladd Pioneer Award, for the work that you had done as the eHealth coordinator within Rwanda. And it's incredible thinking back to that period of time when mobile phones was not necessarily as common of a word and common of a practice as it is now. And I'd love to take you back to that period of time and ask you your thoughts. You know, working in the government at that point, and really the thought process around taking a bit of a leap of faith and really believing in the power of mobile at the time. And if you could share with us a little bit more about your thoughts then and what you had done within the eHealth strategy for Rwanda.
Thanks so much. And, thanks for the congratulations for the award. I was quite excited to receive it. It was not a very easy journey, starting from a time when even the name eHealth or mHealth was very new to everybody. So we started from a point where the word technology meant telemedicine to some people. Technology in health was just telemedicine, connecting between one hospital and another. So one thing that really helped me a lot, or helped us a lot in the ministry, was to define the vision of where we want to go in terms of technology. So we elaborated the first eHealth strategic plan, which, when I say eHealth here, it includes mHealth strategic plan in 2006. And that set the ball rolling. So we started having a common direction to where I want to go. But I'll have to say as well that the government is behind the use of technology in all different sectors in Rwanda. And that also made it a little bit easier. So all ministers, permanent secretaries, directors, and the president actually himself are behind any technology solutions. So technology is one of the key pillars for development in Rwanda, and that made life a bit easier as well. So we didn't really look at how can we use mobile technology. We just looked at which issues do we have and how can we solve them. And where mobile technology was appropriate, we used mobile technology. Where it wasn't appropriate, we used something else. There are even areas where technology is not appropriate at all, and you probably have to do something else. So we developed our strategy from a needs perspective and identified the relevant technologies to be used. And I remember back in the days when we used to sit in these meetings and talk about what should we use, and of course IT people would come up with all sorts of fancy technologies and say, we have this that can solve this problem, but of course it wasn't obviously the case. So that's one. The second was leadership in eHealth, and this is something that's always ignored in many countries. They think that they'll leave it to maybe somebody in charge of HMIS or whoever. They leave eHealth or mHealth to drive in autopilot, I would say. So there needs to be a structure within ministry or within whichever governance structure exists within those governments that controls and gives and sets a pace of which technologies to use, how to use them, and give a general direction. So why not have a Department of eHealth in every Ministries of Health, for example, or Ministries of ICT, depending on how the governments are organized. But there needs to be that governance structure, a number of people that wake up in the morning thinking about how they're improving health outcomes using technology. So hopefully, maybe in a couple of years, we'll be having a meeting like this talking about mHealth as a social right, not a social good. Something that everybody should have access to. If you have a mobile phone, why can't you have access to your medical records, for example? You know, we'll be driving towards that, you know, like Sean said, where technology is, you know, not really being seen as something that is being used, but rather enjoy the benefits of having used it appropriately. Thank you.
Fantastic. So we are hearing this theme around mHealth as not as siloed and standalone, but one where it is part of your rights, something that is mainstreamed within. I'm going to give the last word to you, Matt, before we open it up to questions. We've got less than 700 days until the end of the Millennium Development Goals in 2015. What can this group do? What can this energetic group do in the room and online to really help us get there and help us achieve these goals?
Okay, so we're looking at the next 5 years. No, 2 years, right? 3 years?
2 years. 700
I was thinking
days.
5. Darn it. In terms of, okay, these are the couple things I think we're going to start to see in mHealth I think are really going to be important. One is we're going to see, I think, scaling of HMIS systems. So like MTRAC, DHIS2 systems like that will become pretty much the norm across countries. You're starting to see that. You're going to start to see kind of what Richard was mentioning as kind of this infrastructure within the government, within policies and frameworks to say, hey, there's a way we select, and also a matching open architecture like OpenHIE, which is one of the projects that Richard's leading in Rwanda, to kind of put in place some rules for these systems to allow 1,000 flowers to bloom, but at the same time have some control over this system. I don't know if it's going to happen in the next 5 years, but I think something I hope we'll see soon is a real prioritization of developing a unique ID for women and children. I was just talking to someone at Gates yesterday, and they're mentioning that there's a project they're funding for a child under 6 biometric, which would be pretty game-changing, I think, because right now we don't have a way of kind of tracking kids. We can try RFIDs and things like that, but I think we all know we need a biometric. Once we have that in place, I think we'll start to see kind of large-scale scaling of systems, kind of like ComCare, or we also hope the Smart Registry platform, or tools like that, so giving more than a basic phone to healthcare workers. You're seeing governments like, I think Uganda might be making a large purchase of tablets in the future, looking at really getting these tools in the hands of community healthcare workers to really kind of, and then with row-level accuracy, nail these issues of child and maternal health. I think a big thing that you're going to start to see, and this was, I just was with DHIS2, and this is the thing that their next priority for the next 3 years is, how do we actually build a culture around data? Just because you give people data does not mean they look at it. That's been, for me, the hardest thing about doing mHealth is, hey, look, these great information of starving kids, and there might not be any reaction because A, they don't have the capacity to do anything about it, or B, there's other priorities. And then I think the last thing is, in global health especially, I live in Kenya, and I think the biggest challenge Kenya's going to face is not child maternal mortality. I think they're going to get control of that over the next couple of years is, what do we do about NCDs? What do we do about hypertension? What do we do about diabetes? And that's where the private sector will come in and hopefully play a role in apps. So I think more and more people have their own apps. They'll buy these little sensors. We see a lot. It's kind of, this is the future in 5 years in America now, is what we'll hopefully see more. But it's going to be more needed because the healthcare systems are not going to be able to provide those services, I think, to the average person around the world. So I think private health and mHealth is really going to become the big thing we'll be talking about kind of moving forward. And if you want to make money in this space, it's not going to be helping governments. It's going to be helping people that want to take care of their diabetes, I think. So, anyway.
Great. Well, we've got a little bit of time left for questions out in the audience. If folks have questions, will you raise your hand and a mic will hopefully come to you? Okay, we'll actually start with the Twitter question. What can the mHealth community here at the summit do to help us meet impending 2015 goals? And this is asked by Michael Ospar. Who wants to take that one?
Well, I think it's a general question, and all the discussions we've been having since morning, what we can do, what has been done. So I guess what I can just add is that we can learn lessons from each other and see how we can solve the relevant problems.
And let me just push a little bit more on that, because I do think everyone here does have that goal and that wish. What are the barriers that have been preventing that from happening, or how do we accelerate that within the next couple of years, that really collaboration does come within the technology, the government, the private sector, to really kind of corral around that goal?
My take on that is in the past we haven't had projects that are developed for scale. We've had so many small pockets of pilots here and there, and I don't think that's the best way to really try to achieve the MDGs. So I think designing a project, to not even call it a project, as technology being part of the system, being part of system strengthening, and looking at it as something that is scalable at a national level, not trying things left and right, I guess will be something that will help us. So one of the barriers is that there hasn't been any thoughts about scalability. It was small pockets of pilots that come and go. So that's one way that we can address it.
So two other areas that I think are absolutely critical, and I see them starting to be addressed in the projects that are going to scale. One is government leadership. Around core health systems, you will not get scale. You will not get adoption if this is being driven by outside interests, by donors, by INGOs. And so I think increasingly, particularly in East Africa, we're seeing countries like Rwanda, Uganda, Kenya, Tanzania stepping up, dedicating resources, identifying people, and prioritizing these interventions. And you know, when people ask me, well, how do I get my intervention to scale? Without that government support and buy-in, leadership, vision, you're not going to. The second key area, and again, I'm glad this is no longer controversial, but open source, open data, open standards. You know, when we invest, when UNICEF invests in developing tools, when we invest in standards, these should not be owned by us. These should not be owned by an organization, a corporation. These should be public goods that we release back into the community. And again, I'm very excited that this is now the de facto. You actually have to argue against this if you believe that you know, your great new app needs to be proprietary. And I think this is a huge step for healthcare.
And I also want to kind of touch upon a point Patty brought up in her speech last night at the awards dinner, is that this is also, I think, working in this space has been kind of special and unique in that we're all kind of very small. None of us have fancy, shiny booths like you see in the U.S. health sector. So I think we realize that we're up against a really big challenge, and I think we're still kind of grounded in why we're doing our work. So I think just continuing for us as a community to not lose sight of that and really, you know, try and focus on what you're good at, kind of collaborate in the areas you're not, work around open standards. Because it's going to change, I think, quickly, too, as the bigger groups are going to get involved and there's actually money to be made in this space. I think not losing sight of what we've been doing and what's been kind of our moral approach, I think, to this problem using open source and things like that. I think that's really going to be important.
Thanks, the last word.
Last word.
I would just emphasize partnerships. You said collaboration, Alice, and we pay lip service to it all the time. But in my experience with Mama, you cannot do it without a partnership. We have a partnership of 5 partners at the global level, and at the country level, we have partnerships. Government partners, Sean mentioned, have to be at the table. You have to have your technical partner. You have to have your clinical implementation partner. You have to have your monitoring and evaluation partner. There's no organization that can do all of that on their own. If you want a robust program that can go to scale, it has to be done in partnership. Even if it takes time, even if it's difficult, there's just no way to do it on your own. So I would just emphasize it can't be lip service. It has to be the real hard work of partnership.
Thank you. I think we're out of time, so I'm going to try to wrap up some of what I've heard over the past hour with this great panelist. I think, from now until 2015, we don't have a lot of time, but there is a sense of urgency in the room. If we look back on the last 10 years, whether it be the personal experiences of Joanne as a doctor in practice in South Africa, or with Richard in pioneering a lot of the great work within Rwanda and the e-health strategy, the work happening with Sean and Matt across the board within empowering community health workers, empowering the voice of the individual to then be a voice within the governance within countries, the leadership of governments and countries really coming abroad, the power of collaboration, and then the use of data, not just the collection of data, really coming into the fold to really move the needle from now to 2015. I think we have a lot to be excited about. There's not a lot of time, but there's a lot of energy. And so I ask everyone in the audience and on Twitter and live streaming to really think about the next 700 days and what you can do in order to help achieve Millennium Development Goals 4, 5, and 6. And thank you to our panelists.
Thank you so. Thank you. Can you guys hear me? Thank you so much to our wonderful moderator and our last panel. That was a really fabulous discussion, and we're actually going to transition and switch gears a little bit now to talk about mHealth beyond 2015, a future without limits. We've brought together a really interesting group for you today with a lot of interesting perspectives. So I'd like to ask our moderator, Eric Wicklund from mHealth News, to come up, as well as the 4 panelists who will be speaking on this second fireside chat. Eric is the editor of mHealth News, which is part of the HIMSS media family, and we're really grateful to him for moderating today. And we look forward to talking about the future of mHealth and the sky's the limit possibilities there. And just to remind everyone who is joining us via live stream, you can also ask questions on Twitter. Just use hashtag mHealth13 and hashtag SocialGood. Eric? I'll get your panel.
Hi, everyone. Got kind of a tall order to fill after that first panel, but I think I've got just the people to do it. As Chelsea mentioned, my name's Eric Wicklund. I'm the editor of mHealth News, the mobile health publication of the HIMSS Media Group. Today we're going to be talking, we're having a fireside chat here. I haven't seen the fireside, but we're all going to be sitting here talking about the future beyond 2015, going a little bit farther than what you just heard. Going to talk about some trends and some possibilities, and probably touch upon some of the things that are going on now in mHealth. And feel free to actually start with a definition of what mHealth means to you. What I'm going to do is identify my panel, and then I'm going to let them talk. I generally my mind goes blank when I sit in front of a crowd, so I'm going to let them do the talking. I'm looking forward to questions. Anyone got questions, raise their hand as we move on. Today we have Gustav Prekelt of the Prekelt Foundation, Jack Andraka, who is a scientist, a researcher, an inventor, and most importantly, a teenager. We also have Mohini Bhavsar of Dimagi and Caleb Tiller of the UN Foundation. So I'm just going to pass it on and let them talk.
Great. I guess I'll talk a little bit about what Dimagi does in general, and then we can sort of move on. But Dimagi supports the development of ComCare, which is an open source case management software. Primarily, the tool is used by community health workers. I support Dimagi's field operations in India. So we're working with ASHA workers, which are government incentivized health workers, using ComCare to track pregnancies and children over the course of 1,000 days of life. One of the things that we've learned with implementing with organizations across India is the focus has primarily been on the technology piece, but the technology piece, so the development of the mHealth tools it's becoming easier and easier, and really the challenge has been figuring out the people and the processes associated with the adoption of mobile tools and with in order to use the tool for a longer period of time. We find that organizations need to think a little bit more about the feedback loops that are necessary in order to improve program surveillance, in order to improve supervision of FLWs, and ultimately to use mHealth tools to create smarter systems. So that's kind of what our learning has been, and I'll just sort of pass it on to the rest of the panelists.
Thanks. I'm Gustav Preikelt from the Preikelt Foundation. So we really concentrate or specialize in building what we call population scale systems. So to help organizations, specifically social impact organizations, leverage their scale by using mobile phones. So as to your question about what I believe mHealth is, it's quite a difficult question, but I think specifically the way we think about that is a mobile phone is an intensely personal device. And so we think really about how to build systems that are valuable and useful, but at a very large scale and to individuals. And we think the opportunities really with health in the long term is to tap into the patient and about their needs and to think about the type of services they want. So to that end, we've helped organizations like Mama build very large-scale systems that really allow mothers to not only get information on their device, but also to connect to other mothers. And I think in the long term, what we're really interested in is the whole question of peer effects and how people will connect with each other and how they will learn and how they will be able to take responsibility and control of their own health outcomes by providing information to them at the right time and on the device that they own. So we're really excited about the opportunities inherent in this revolution where every single human being has got a device and can connect with the people that they need to connect with to get that information.
Wow. Okay. So what I do is I create a new way to detect pancreatic, ovarian, and lung cancer that costs 3 cents and takes 5 minutes to run. So it's 168 times faster, over 26,000 times less expensive, and over 400 times more sensitive than our current methods of detection, but also could be broadly extended to pretty much any disease, ranging from Alzheimer's to other forms of cancer, even HIV, AIDS, and heart disease, and so far has over 90% accuracy and could detect the cancer in the earliest stage, when someone has close to 100% chance of survival. So to me, mHealth is really democratizing healthcare such that no matter where you are in the world or no matter what your background is, what age you are, what gender you are, you'll get the exact same healthcare treatment and the exact same standard of diagnostic care.
Thanks, Jack. Hi, my name is Caleb Tiller, and I'm with the UN Foundation. At the Foundation, our mission is really to mobilize audiences of a variety of sorts to support the best work of the UN. And we do that around a variety of different issue areas, from global health to energy and climate to women, girls, and population. The Foundation is also the home of the mHealth Alliance and of MAMA, which we've been talking about today on the earlier panel. So we work across a wide spectrum of different issue sets. I'm by no means an mHealth expert. I think I am a bit of an outlier on this panel. in that regard. And I think what I'm really here for, and I think the different audience perspective that I can bring is really around how we mobilize our audiences to support social good, right? How we bring together people, people, foundations, corporations, and various sectors to support those missions. I was looking for something really cutesy to say, like you can't spell mobilization without mobile, but it doesn't really work. But you get the idea. I mean, that's we're here really as a foundation to kind of bring together those varieties of audiences. And for us, mobile is absolutely core to that, particularly as you're looking post-2015. I think we will get to a place, right now, I think the sector, both the international development sector and also the nonprofit sector, both of those sectors are in a place where we're trying to figure out mobile. I think we've made a lot of progress in the last few years. I think much like some of the conversations I hear here and in other places about mHealth, I think a few years down the road, we will likely be in a place where it's not differentiated from what we do, where we don't say, how are we going to integrate mobile into this? It will have become absolutely core and essential to what we do. I think we're almost there. I think we see it that way. We just have a few more steps to go to get us there.
All right, I'm going to just move right to a question that we'd received from Twitter. And since Caleb had the good fortune to stand next to me, you're going to get that first question. Could you explain some of the governance and regulatory issues that are facing the mHealth field now, and how they're going to evolve over the next few years?
So I hate to do this, but I think I'm going to have to pass on this question. Can I hand this to you, Gustav? Is that okay? Yeah. I think you're in a much better seat to answer that question.
I get the tough question. I mean, I think the issue about mHealth obviously is we have this incredibly democratizing device where we can provide information to every human being, and they can respond. And we keep really sensitive information about every person. We have a particular challenge, or a great example of that is we have a social network called Young Africa Live, where we have over 1.7 million young people, mostly teenagers actually, discussing intensely personal issues around sexual health, around their HIV/AIDS status. And one of our challenges was that in a social network like Facebook, you have your real name, and we can't have those type of discussions in public. So we said to users they need to create private profiles. So we have this kind of contradiction in terms, which is a social network with privacy, and how do you build that in? And I think in terms of it's a very specific answer to your question, but in terms of regulation, I think one of the big challenges for us is really privacy, and how to maintain that in this age where people are so used to sharing information. And it's particularly much harder in the health space than it would be in other areas that we would work.
All right, let's take a little different track. How can we capitalize on some of the attributes of the younger generations to kind of advance mHealth in the future? And I'm looking straight at you, Jack, for this one.
So I think that by incorporating the 2 billion global citizens that are under the age of 20, we can really begin to see this change in the paradigm of how we really look at mobile healthcare, because teenagers are kind of at this moment where they're at the epitome of creativity and knowledge, where they have enough knowledge to make these crazy ideas come into reality, but they have the creativity to first come up with those ideas. And also what I think is that first they're very obstinately and sometimes annoyingly stubborn. I know I am at times. And they have a lot of time on hand. For example, in my story, I spent my entire summer break researching proteins that I could use in my project. And I think that by capitalizing on that free time that teenagers and the younger generation has, then we can really begin to see a lot more innovations in healthcare.
I guess for the sort of, I would say, new generation of people that are entering the mHealth space, I think what's important is not to build on the hype, and we are here to solve, some pretty important problems and issues in the field. I think we need to think about, how to strategically, use mobile health devices and use mobile health applications to improve, program surveillance and things like that. And I think it's important to come with a realist, approach and not sort of build on the hype, because there is a lot of it, and a lot of it will sort of expand as mobile health becomes more and more mainstream. So I think we need to sort of have a realist lens to the work that we're doing.
Yeah, maybe another example, not necessarily around youth, is if you think back about 10 years ago, I don't know if any of you remember looking at Wikipedia and being excited when there were like 5,000 articles, and then there were 10,000 articles, and now, I don't know, it's 1 million, 3 million, many millions. And I think the exciting thing is to tap into the audience that has grown up with that paradigm, where they assume that they have control and that they can participate in these media sources, and that have grown up with platforms like Facebook. And so we see one of the most exciting projects we're working on at the moment is the launch of Wikipedia for any phone. So you can have a dumb phone with only text capacity, and you could utilize that to access the world's largest repository of information. Now, if we can give that type of access to every single human being, and not just to consume the information, but also to participate in the creation around that information, I think that's an incredibly exciting opportunity for us to create content and information sources that are viable and believable to our end users.
And I would just add to that you've got a generation of people who are digital natives, right, who have grown up essentially with a device with them at all times and are used to that level of integration into their day-to-day workflows and social lives. And I think there's a real opportunity to leverage that. I see for us, and again, in terms of social mobilization and getting people to participate in trying to affect positive social change, we've seen a couple of things recently. One was with Giving Tuesday, which was a kind of day of celebration of giving back that came right after Thanksgiving, and you have Black Friday and Cyber Monday and then Giving Tuesday. And we had 10,000 different organizations who participated, and it was really an open source philanthropy opportunity. Each of those organizations made it into their own celebration and asked people to participate in a variety of ways. And one of the things that was created was the concept of the unselfie, and it kind of took the selfie photo that people take all the time, particularly younger people, and share on their social networks, and kind of turned it on its head and said, what organization are you supporting? Why? What causes matter to you? Take a picture, share it with your friends, tell them what matters. And that particular hashtag really took off and trended for in a couple of different times over several weeks on Twitter, on Instagram, and really helped drive a lot of the attention that led right into Giving Tuesday and made it a tremendous success. It's something that wouldn't have been possible without the participation of the youth generation that you asked about. A similar phenomenon that I think about is actually J&J's Donate a Photo, which is an app that allows people to take a photo, donate it to a variety of causes that J&J is supporting. J&J in turn donates $1 for each photo and the user can select, I want it to go to this cause or that cause. There are about 10, I think, currently. And that sort of level of sharing would not really work, and the donations wouldn't be driven without the participation of youth who are so used to engaging in that way on a regular basis anyway. So I think it's the answer. It's a long way of saying kind of the opportunity is to leverage the existing behaviors and give youth participants a way to take part in something that feels like an extension of something that they're already doing.
All right, we have a Twitter question, and I'm going to modify it a little bit. If the sky is the limit for mHealth, what do you want to see mHealth look like in developing countries in 2030? And I'd extend that out, not just developing countries, all over the world.
Well, we can ask for anything, right? Well, I mean, I think it's not, as Bill Gates who said that we always overestimate the impact of technology in the short term, and we underestimate it in the long term. So I'm sure the wish and my moonshot that I've got is going to seem interesting now. In a couple of years' time will probably be extremely boring. But just looking at the platforms that we have built and the participation we've seen, a really key impact has been the cost to end users. When that cost gets driven down to the point where our users aren't thinking about every single tweet or every single connection that they make, then it has a huge impact on the kind of viability of that platform. And so my dream really is that we will be here in a couple of years' time where every single human being on the planet will have a device, a personal device, and will have access to personalized information, life-saving information around, be it maternal health information or Wikipedia or malaria information or any other kind of information that they need at that time at zero cost, and also have the ability to contribute back to that source information and to share that with people that they feel they need to share it with. And I don't think that's that far off. I mean, it's a moonshot, but I think we can do that in the next 10 years.
I guess what I'd like to see is, empowering organizations that want to use mHealth tools, build them themselves. So like some of the stuff that we do at Dimagi is, we support a platform in which there are authorship tools and you don't have to be an engineer or a software engineer to come and build your application. So some of the activities that we're focusing on now is training organizations to build their own tools, modify their own tools, launch them by themselves. And I would really, what I would really like to see is more and more people with a non-technical background being able to develop the kinds of tools that they do want to launch. I think also coming from the community health worker perspective, I'd really like to see content that isn't necessarily related to their job on the application itself. We're giving out devices to health workers across the world, across India, but they're also using the devices for other things. So they're logging onto Facebook, they're using WhatsApp, they're texting, they're finally learning how to text for the first time in their lives. How can we leverage these types of indirect, unexpected benefits or unexpected sort of occurrences that are happening in order to empower health workers that we're working with, and most of these health workers are women, so it's an interesting space and an interesting opportunity for mHealth.
Okay, thank you. So I think I'm not creative enough to think quite so far out as 2030, but I see a couple of things happening right now that I hope will continue to extend. And we mentioned one of them earlier. I think it was mentioned in the earlier session as well, is that I think this distinction about what is mobile and what isn't, I think will largely fade away. And I think that's a really important change. Because I think most of the behaviors that we can do online now are becoming mobile and will continue to do so. I think we'll see some, and I hope that we'll see some really interesting kind of cross-border and international interaction in ways that we're not seeing today. We, at the Foundation, recently hosted a session leading into the G20 that was called G Everyone, and it was designed to enable people all over the world to participate in a variety of conversations throughout the day, which then the outcomes were then fed into the G20 and were shared with global leaders. And one of the really interesting pieces of what happened was there were some radio hosts who were in one of those sessions. They reached out to some of their partners in Tanzania who broadcast a question on Tanzanian radio. We had Tanzanian farmers who then responded via Twitter and were able to, by text SMS into Twitter, take part in this conversation that was happening with a variety of participants around the world. They weren't online in the sense that I think of it, but they were certainly online using, they heard the radio broadcast, fed back in via Twitter, and I think those opportunities to break down barriers and have cross-cultural conversations are really important between now and 2030, and I think they'll change the way that we think about the world between now and then.
We're nearing the end of our session. Does anyone have any questions that they'd like to ask? Oh, someone does. We have a specific request here. Can Jack talk about his work on the Tricorder X Prize and why is it important to mHealth?
Yeah, so this microphone does not like me. So that's also part of my vision for the 2030 is that really that everyone will be able to have the same standard of diagnostics. And I'm trying to accomplish that through what's called the Qualcomm Tricorder X Prize. It's sponsored by the Qualcomm Foundation, and it's a $10 million prize to develop something the size of a smartphone that can detect any disease instantaneously. And there were 300 teams working on it. However, now it's down to 34. And one of my teams is actually one of those 34, and it's a team of all high school students, and we're going for the prize. And so far what we've developed is a wristband that actually monitors all 5 of your vitals, plus your glucose and your hemoglobin concentration, and continuously logs them in a smartphone app. And then also it has a kind of like a pH strip, but for 20 different diseases that develops within 7 seconds and can instantly diagnose those diseases. And so it's kind of like a doctor in your pocket, you could say.
All right, well, let's close this with one last question I'm going to ask of everybody. What is the biggest barrier you see to the advancement of mHealth right now, and how can it be overcome?
Well, I always get you want to go first. So I think if lowering fruit cost, if we can drive down the cost of access, so every human being can get the information that they need for free. I don't think devices are really the problem. There are enough devices in the market, and the cost of those are going down tremendously. If you think about the value that a mobile phone brings to somebody in a village somewhere in Africa, the little bit of investment to go and buy a device is not really the barrier. But we really have a regulatory environment and a framework which is not conducive to people being able to afford the information that we have. It's really a crying shame that we are able in this day and age to have Facebook available for free to 40% of the people in Africa, and yet we cannot deliver life-saving information to those same people. There's something wrong in the world well, I think at least there's something we can do about that, and I don't think it's really hard.
I'm going to say capacity building is, should be a focus, and it is one of the sort of challenges in scaling mHealth. So the institutions and organizations that we work with at every level, there are roles that are necessary for running that mHealth program, and there are competencies there where they're not there, the competencies that are required to sustain and support and train the health workers and that kind of stuff. So I would say, that's one of the biggest barriers, and in order for mHealth programs to scale, we really do need to focus on the people and on the training component, and identify what competencies, what capabilities are necessary within organizations, within the staff of that organization, in order to support large scale deployments. I would say that.
So I think that one of the largest problems that we're currently facing, not only in mHealth but the entire scientific world, is the issue of paywalls, because 90% of all scientific journals are locked tightly behind these paywalls. That means when you want to access them, it costs $35 per article. And because of this inhibitive cost, it makes it exponentially more difficult for researchers to create more mHealth technologies. And also in really getting the youth interested in mHealth, it's become a problem, because we see all these big STEM initiatives, but when a Katy Perry single costs 99 cents versus a seminal science article costing $35, it's a bit of a mixed message. And so I believe that, we currently have this kind of knowledge aristocracy where only 0.008% of the population, that's 80 people out of the entire city of New York, for example, those are the only people that have access to scientific articles. Then you have 20% of the world. Those are people like you or I, that we have access to the abstracts and the few open access articles. But then there's 80% of the world's population, 5.5 billion people, who don't have access to the internet. And I believe by abolishing those middle and lower classes of the knowledge aristocracy, we can reach this place where it doesn't matter where you're from or whether you're a billionaire or living on less than $1 a day, that you'd have the exact same access to this knowledge, and then also the exact same access to healthcare, because science and healthcare shouldn't be a luxury and knowledge shouldn't be a commodity. It should be a basic human right for everyone.
Well said. I don't really want to follow that, but I will. I'll try. So I think in terms of really mobilizing audiences to support good health outcomes and bringing in supporters for those kind of social good. I think the biggest challenge that we face, the biggest opportunity going forward, is finding out and figuring out the right ways to have sustained involvement. And what I mean by that is we have really good moments throughout the year. There's World AIDS Day or the Social Good Summit or the Global Mom Relay. There are these great opportunities where lots of people get really involved and really focus on an issue and talk about it in a really big way that focuses a lot of attention. And it will trend on Twitter, and we'll see increased donations and other kinds of increased involvement. But in large part, those are very short-lived, and the community that is most involved and most focused on it in a sustained way is not as visible. And that's exactly, we're here today as part of a plus social good. It's exactly kind of the theory that's driving the plus social good community. So this is one potential answer, but I think there are lots to come, and I think that's one of our most important challenges and opportunities going forward. Thank you.
All right, well, thanks very much. It's been a wonderful panel.
Great. Well, I hope that you all enjoyed both of those panels. Before we have closing remarks from Patty Michelle, who's the Executive Director of the mHealth Alliance, I just want to give some quick recognition to the online community that has really been building a drumbeat around the mHealth Summit and around this idea of envisioning the future of mHealth. We've had some really great Twitter activations. We had a month worth of mHealth Mondays, which was really wonderful. And we also had a wonderful Twitter chat in partnership with HIMSS. And one of the things that we've been asking the online global community to tweet about and tell us about is their vision for what the future of mHealth will look like. And we've picked a couple of our favorites. So I just want to share those with you quickly. This is from @MelodyBenford. She's from Beaumont, Texas. And she says that the ability to self-monitor vitals and to make decisions without being so stressed about nutrition or habits, that's her vision for what the future of mHealth looks like. So thank you, Melody, for that. And @Roz_Davies from Sheffield in the United Kingdom said this on Twitter: citizens need to feel confident, informed, and connected to become healthier. mHealth can contribute to all three. So we will actually be sending Melody and Roz a little solar cell phone charger to say thank you for being such active and engaged members of our online community. And now we'll be hearing from Patty Michelle, who will give us some closing remarks.
First of all, I would just like to recognize Chelsea Hedquist, who really pulled together this mHealth+SocialGood and turned it from a concept into a reality. And to all of our speakers who presented today, and to Johnson & Johnson and HIMSS for making this possible. So what I like to spend a little bit of time reflecting on is the look back to the MDGs and where mHealth has come from and where it's going sort of in the post-2015 agenda, and really synthesizing a lot of what our esteemed panelists have shared today. A little bit of history on mHealth, and some of my colleagues here have been very involved in it, but a lot of mHealth implementations actually started with MDG 6 and with HIV and AIDS and with tuberculosis, actually. And then we saw this rapid transition in just the last few years to look at mHealth for maternal, newborn, and child health. And we've seen a rapid mainstreaming of it into the Every Woman, Every Child, Secretary General's movement on really reducing child and maternal mortality and reaching those goals, and mHealth as a critical strategy and tool and approach within that movement. We have the great privilege at the mHealth Alliance of working with the Norwegian government and WHO on a catalytic grant program that really helps to surface to the top really promising mHealth for maternal, newborn, and child health interventions that are now poised to reach 31 million people through 26 grants in 14 countries. Now, a year ago, we just started talking about scale. This year, we're actually starting to see it, and we're starting to see some real impact in terms of what mHealth is doing. And so as we are in the last 700 days to the Millennium Development Goals, we now have a real opportunity to see mHealth become a critical strategy in eliminating mother-to-child transmission of HIV/AIDS. There are programs that are now scaling to do this in countries like Zambia, Malawi, Tanzania, and elsewhere. This is huge. We have efforts by malaria programs, including Malaria No More, which it has launched a campaign that malaria could be the first disease that we eliminate through the use of mobile technology. And so there's some real momentum that we have here. And what we really need to see, and this has been reflected in the comments today, is a real concerted, collaborative approach. There is no one partner in the ecosystem or in the global health community that can actually do this. We need the additive impact and the expertise that each partner, whether it's from the private sector or the public sector, can bring into this work. And as the mHealth Alliance, we're really thrilled to be sitting at the intersection of this and really helping to facilitate that mainstreaming process. As I look ahead into the sort of post-2015 agenda, there's a lot of discussion within the UN right now about what the next set of goals are going to look like. And so there's a lot of discussion around universal access to healthcare. There's a lot of discussion around non-communicable diseases, which was brought up earlier today, and where mHealth and technology can be used to help support those pieces. And I think from whatever position it is that you're in, either as an individual caring for your own health or the health of your own family, or even just kind of thinking about the world that you want to live in and the type of health system or healthcare that you want, just know that there are billions of others in the world like you, including lots of young people, 2 billion we heard earlier today, who are thinking through some of the same issues. And it's really incumbent upon each of us and it's in our interest to think about how we want to interact with the world, with the health system, to live healthier and better lives. And I really look forward to strategically thinking through how we do this as we move forward, and working with you all to really help support the country leadership that we talked about today, as well as the collaborative engagement across the ecosystem. So thank you for joining us for this mHealth plus social good. I'm going to borrow Richard Gakuba's quote. It'll be amazing when we can see that mHealth becomes a social right and not a social good. And I do think we're in that transformative wave right now, and we will get there, and it will be due to the tireless and passionate and creative efforts of everyone here at the summit, everyone online joining us, and the many billions who weren't able to join us. So thank you very much.